Doctors say when a person becomes infected with COVID-19, their blood type can make a big difference in how sick they get.
This is kind of a curious thing, but if you have A positive blood type, you probably have about a 30% greater chance of ending up in the hospital than if your blood type is O.
Young people tend to avoid hospitalization, and that's largely who's testing positive, causing the death rate to plummet.
From at 1.5% to about at this point, as of today, 1.5% in the state. And in Tampa, in Hillsborough County, it's actually below 1%. It's about 0.9%. So that's one of the lowest case fatality rates on the planet, quite literally.
School children carry the lowest risk of both acquiring the infection and becoming very ill.
For the most part, I think schools should reopen. There's some areas of the state where I may not be quite as enthusiastic, but for the most part, I think that we are going to be okay.
Hospitals reportedly made it past the peak.
We know that emergency room visits for COVID-like illnesses and influenza-like illnesses are dropping. And that's the first sign that things may be improving.
Doctors now rely on treatments they didn't have before, such as remdesivir and the affordable dexamethasone, both scientifically proven to work. Lori Johnson, CBN News.